Okay, great. Well, thank you everyone for taking the time to join today. This is our November meeting of our Medical Marijuana Testing Advisory Council. And I am the chair for today. I'm also joined by Kim Crawford and also Megan Whitby. I believe we are starting out. We'll have to see if we have a quorum. So looking online from what I can see, and you can correct me, Stacy or Megan or Kim, if I'm not seeing everyone. I think I only see 1, 2, 3, 4, maybe 5 members. Is that correct, or do you see more at this point?
Right now, I think I count 8, and we need 9.
Yes. Okay, so
count again.
Okay, I see.
Yep.
Can you tell us who's missing?
Let me see. So what I have on my list, it looks like we have Maxwell Lung is present. We have Murray Stein present. We have Connor Griffith present. We have Victor Hugo Ramos Sanchez present. We have Ahmed Munshi present. Who else am I missing there, Kim?
We have, so yourself, Connor Griffith is on the line. It looks like Joe Demena, Jay Neary as well.
Okay, 1, 2, 3, 4, 5, 6, 7, 8. So we have 8 people. So we are missing. If any of you, any of the members of the council online can maybe reach out, just as we do sometimes. I ask you by email or a text to the other members. The other members currently not online are Timothy Nolan, Steve Cottrell, Matt Lascala, Elizabeth Brady, Ty Garber, and I think that's it, because we've got 3 vacancies currently on the council. So if any of you have any of their numbers or emails, please feel free to reach out and ask them if they are able to join. Like I said, we just need 1 more member to form a quorum, and then we can get started. See anyone else on your side, Kim? Oh, there's someone now. Let's see who that is.
I just got a text from Steve Cottrell. He's missing the invite. If someone could send that to him. Steve Cottrell.
I'm in the process. I also just spoke with him.
Oh, great.
Okay, great.
You mute us.
And if we just get 1 more member to join, we'll have a quorum, and then I can take the roll call, and then we can begin. So thank you for bearing with us at the minute till we get our quorum, and then we'll get started.
Well, while we wait for that, I'm not sure if there is an agenda for this meeting, but I'm not sure if that went out or not. I did not receive one.
There is an agenda, and I don't know, Stacy, if you could resend that. There was an agenda and a PowerPoint, I believe, is going to be presented at this meeting. I know that was actually on the ADHS website, so under the Medical Marijuana Testing Advisory Council. I know it was posted there, certainly. So either maybe Stacy, if you could send the link or send
I
those
see.
two.
I see it on online. Thank you for that.
Okay, perfect. Anyone else have any problems seeing the agenda or the presentation? And I know we'll pull the presentation up and it'll be available on your screen as well. Okay, I've seen someone join there. I'm not sure if that was Steve. What can you see from your side? Megan or Kim, can you see, are we still at 8 members?
Yes, we're still at 8.
Okay, hopefully we can get Steve on or oh,
I've been texting with him. He's trying to get in.
I see him. I see Steve there. So that's great. Perfect. Thank you for joining, Steve. We appreciate it. So that is our 9th member of the quorum. Hopefully others will join, but that means we can begin. Again, welcome to our November meeting of our Medical Marijuana Testing Advisory Council meeting. I'm your chair for today, and also I've got Megan here, Megan Whitby, and also Kim Crawford. Thank you again for joining. And I'm going to go ahead and start with a roll call so that we can ensure we have documented a quorum, and then we'll be able to proceed. So when I call your name, if you could please unmute and let me know if you're there. Maxwell Lung.
Here.
Thank you, Max. Murray Stein.
Here.
Thank you, Murray. Timothy Nolan. Timothy Nolan, I didn't see him online, so Timothy is absent. Connor Griffith.
Here.
Thank you, Connor. Steve Cottrell.
Yes, I am here. Thank you.
Thank you, Steve. Matt Lascala. Do we have Matt Lascala present? I don't hear Matt. I'm marking him absent. Joe DeMena.
Here.
Thank you, Joe. Jay Neary.
Present.
Thank you, Jay. Elizabeth Brady. I don't hear Elizabeth Brady. I will mark her absent. Zhonghua Xiong. Again, Zhonghua Xiong, are you present? I don't see him online, so I will mark him absent. Victor Hugo Ramos Sanchez.
Here.
Thank you, Victor. Ty Garber. Ty Garber again. Okay, I don't see Ty Garber online, so I'll mark that absent. Ahmed Munshi. Ahmed Munshi, I can see you online.
Here.
Great, thank you very much. And then also, as I mentioned, we still have 3 vacant positions. One vacant position is the owner of an AZ cannabis testing lab. and the other is vacancy is a registered dispensary agent, and then the last vacancy is a licensed healthcare provider. And as always, if you know anyone who might be interested in filling those positions, please let us know. As you know, we can sometimes have challenges getting a quorum, so the more folks we have, if we've got a full council, that will certainly help us there. So again, appreciate you all joining today. Welcome, welcome to our November meeting. And with that, we have a confirmation of our quorum and we can proceed. I'll just start out, as I usually do, with sort of a review of open meeting law reminders and also the council's charge. First, just a reminder of open meeting law that we may only discuss topics that are present on the agenda. You can request to have items added to the next meeting agenda, and they will be added to the next meeting. Please do not make comments in the chat, and please use the raise your hand function to participate in the discussions. If there is a motion made and seconded, we will vote on that motion before entertaining another. Again, the council's charge is the Medical Marijuana Testing Advisory Council shall annually review the marijuana testing program and submit a report by the second Monday in January. And this report should include recommending analytes to be removed from the required statutory testing panel. It should also include de-identified information about testing related deficiencies cited against licensed marijuana facilities. And finally, it should include any other recommendations on improving the testing program. So with that, we will go ahead and move into our agenda. And first item on our agenda is Connor Griffith, and he is going to discuss why removing E. coli, Salmonella, and Aspergillus testing for inhalable products benefits the industry without negatively impacting consumer safety. So Connor, I will turn it over to you, and I think we can bring your slides up for you.
Great. Yeah, however you guys want to do it.
Can we do that, Stacy, or would you like Connor to present his slides?
Let's see. I know I'm a meeting co-host. I should be able to do it. If you...
Okay, I think we're good to go. It's all yours, Connor. Thank you.
Great. Yeah. So quick note, I would like to edit it. We're not going to be approaching E. coli or Salmonella on inhalable products. I'm going to focus entirely on the Aspergillus aspect of it. You can do the next slide. So for those of you that don't know me, my name is Connor Griffith. I'm one of the founders of Level 1 Labs. We're one of the compliance testing labs in Arizona. We've been open since 2018, so we were involved when it was a medical-only program. We watched the implementation of REC. We watched mandatory testing come online and all the nuances with that. If you can go to the next slide. So we've seen a lot progress over the years, and this is the regulation as it stands right now, is that all inhalable products have to be tested for E. coli, Salmonella, and then the 4 Aspergillus. Aspergillus is really the pain point because it's a qualitative test. It's not a numerical value. It's either detected or not detected. There's a few different ways that the producers can handle it with a fail. If you can go to the next slide, please. Yeah, so what we have here in the bottom right is how it's broken down to right now. So full panel refers to the full myriad of safety tests needed to sell in a dispensary. For this instance, if a product fails Aspergillus, there's 2 options that the producers can do. They can either challenge the first lab and get Aspergillus retested at a second lab. If it passes the second lab, it moves to a third lab. If it passes the third lab, that negates the first lab's fail and that product is in fact a pass, is compliant, and is easy to go, ready to go. So full panel, most labs, you're looking at about 3 to 5 days for a turnaround time. And then including the other 2 Aspergillus retests, you add another 3 to 5 days and another 3 to 5 days. So a process that should take 3 to 5 days can take upwards of 15. And it's a long time in the cannabis industry when everything's go, 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 go. So the other option that producers have is they are able to remediate the product and resubmit for testing. What I showed down here, there's a couple companies that make equipment like this one pictured here. And essentially what they do is they use gamma radiation to destroy the Aspergillus in the sample, effectively rendering it so that it'll pass. You can see on there, we got the sticker price point of $350,000 for one of those things. So it's a pretty high cost of entry.
That's an old price.
Yeah. What are they running for these days, Steve?
Yeah, they're in the middle 4s. I have one in New Mexico. So
Wow, okay.
yeah, it's
Yeah,
a big
inflation.
microwave, ladies and gentlemen. It's a gigantic microwave, is what it is.
Yeah, I call them the cancer box. They're scary. They got a couple 100 pounds of lead in there, and it's some Bruce Banner type of stuff. But so you can get one of these, and they're very effective. I've seen firsthand a client, they had about an 80% Aspergillus fail rate. They acquired one of these machines, and that went down to about 2%. And so, like I mentioned earlier, Level 1 Labs, based on the name, we had a salesman come in and approach us thinking that we were an extraction lab, not knowing we were on the testing side of things. And he's a cannabis sales guy, so he's kind of Jude Bro-y, and he's breaking it down, and he goes, look, man, here's the deal. All you got to do, you don't have to throw your whole batch in here. Just whatever you're going to send to the lab, put that in here, hit go. You're good to go. Aspergillus won't be an issue. And so in my mind, it's a paper tiger test. I mean, it's not even relative. And the big boys, clearly there's a not so level of a playing field on Aspergillus. And the reality is, and this is from the CDC, is that it's ubiquitous in everyday life. You would be pressed to find an environment that does not have Aspergillus in it. Unless we're in like a Taiwanese semiconductor clean room, the room you're in has Aspergillus. If we can go to the next slide. Yeah, and so that brings us to the point of why do we even have this regulation? And it's because Aspergillus, when inhaled, is problematic for those that are immunocompromised, specifically those that have chronic lung conditions as well. That being said, I am not a medical doctor. I can't give medical advice, but in my research, what I've found is that everyone who's immunocompromised is very adamantly suggested that they don't smoke anything whatsoever, regardless if it's medical marijuana, XYZ. There's a ton of things they can't do. They can't garden. You have to wear a mask in public. If you were to go to a deli and immunocompromised, you couldn't order tuna salad, chicken salad, egg salad, potato salad. You couldn't eat the coleslaw. You couldn't eat the deli meats, the cheeses. So there's a lot of barriers that immunocompromised people face. And Aspergillus is, like I mentioned, prevalent. So there have been recalls in the state of Arizona specific to cannabis and Aspergillus. I don't have the exact number at the top of my head. I want to say it's around 10 recalls over the last 5 years. And if the state, please correct me if I'm wrong, but in my research, I wasn't able to find any reported illnesses with any of those associated recalls. So while, yes, there can be Aspergillus in cannabis, kind of the bottom line is that it doesn't really impact the majority of users. I don't know the statistics of what percentage of patients are immunocompromised, specifically paired with lung issues, but what other states do is attach a sticker on the product that says this may contain Aspergillus. So it's there's ways around it. If we can go to the next slide. And here we have Oregon as a perfect example. So Oregon's market is a lot more mature than Arizona's. They've been operating longer than we have. They had mandatory testing in place much longer than we have. And they had it in place already for about a decade when in March of 2023, they decided to add Aspergillus testing to their test panel. They experienced about a 10% failure rate, and the Oregon growers got together and actually sued Oregon Health Authority for making them do the tests, saying that it was an undue burden on the industry. And on August 25th of 23, a court took the case and they suspended the Aspergillus testing for 180 days while they reviewed the comments and arguments from both sides. Before that 180 days expired on September 15th, Oregon Health, they came out with a temporary rule that said that Aspergillus testing would no longer be required, and that I believe they backdated that anything that was previously failed beforehand was now good to be sold. If we can move to the next slide, please. And yeah, so essentially testing cannabis for Aspergillus is really unnecessary. It's a burden on both the producers. Test labs take a lot of flack for it, and at the end of the day, it's kind of a paper tiger test. So the people that are most at risk are already urged by medical doctors to not smoke. And there's so many different product types available across the industry. I think at this point it'd be a shorter list of what hasn't been medicated at this point. And so medical marijuana patients will still have access to products that help them, but just should, with proper guidance, steer clear of the inhalable kinds. And so one argument is that Aspergillus, when it's in large concentrated amounts, it can chemically convert to mycotoxins. I believe it's ochratoxin. And mycotoxins are a carcinogen for everyone. That's definitely not the argument here. But the good news is that we still have mycotoxin testing on the concentrate products themselves. So worst case scenario of Aspergillus and a big amount morphing into mycotoxins, we would catch that on the concentrates as well. And yeah, so I'm gonna pitch a motion that we remove Aspergillus testing from all inhalable products.
I think normally prior to the motion, we want to make sure that there's an opportunity for any other members of the council present that would like to speak on this matter. Also, the department, these are not materials put out by the department, nor are they reflective of any medical or legal advice, as Connor has said. Also, if you are interested in other materials about this, just for a little bit of history, if you go to the Medical Marijuana Testing Advisory Council page and go down to 2019, that was the very original council that had robust discussions. I think some of you were a part of it even back then, about many different analytes and what should and should not be included in that original medical marijuana testing requirements. That information is all still available online, including information about Aspergillus. Also, just as a slight history lesson, when adult use was passed through the Smart and Safe Arizona Act, the original testing panel for adult use did not contain Aspergillus testing, because there were comments that it truly was only, we received a lot of feedback that it was mostly potentially harmful for those that were immunocompromised. It was actually this committee in, I believe, 2021, and that report is also online. I don't think it calls out in the report specifically aspergillus, but I think if you go back to the meetings, I believe it was discussed. This committee in 2021 urged the department to include it in the adult use test to make the panels match for both adult use and medical. So just as a history lesson, because it's easy to forget all of that, I just wanted to make sure that all of that information was out there as well. And then I think we need to open it up to see if there are other committee members who would like to speak on the topic.
Just go ahead, Joe.
Hi. So really appreciate the presentation, Connor. A lot of really good information and suggestions there. I think from the patient perspective, you know, I would want to approach this type of conversation as cautiously as possible. You know, I kind of would love to hear a little bit more from medical providers and medical marijuana certifiers on sort of their thought process, and hearing a little bit more from patients who are immunocompromised, rather than sort of a one-size-fits-all approach of unilaterally getting rid of it. I also think it's important to sort of note that, you know, the recall process, we haven't heard of any actual cases of people getting sick, which I think suggests that the recall process is working correctly. We certainly don't want to, you know, have someone who's not doing well sort of validate that. I think it sounds like the DHS has some pretty good safeguards in place. So I would say that at the present moment, I'm probably a no on this particular vote. But I am very open to hearing from medical providers and people who can talk a little bit more about the immunocompromised population and how this might potentially affect them.
Okay, thank you for those comments, Joe. Connor, did you want to respond to any of those comments?
No, yeah, you know, it was actually Joe who brought it up back in Megan's history lesson, November 9th of 21, when aspergillus was brought up. It's yeah, you know, like I said, I'm not a medical doctor. But you know, in that instance, I think it would be helpful to find out what the percentage of immunocompromised patients are. But like I mentioned, there's just so many different product types available that it's kind of overkill.
I know that Maxwell Lung also has a comment. I also think it's important to point out that our patient population has dropped since around 2020 from over 300,000 patients when adult use passed to about 80,000. And so there's also, just to be aware, there may be other people who are immunocompromised more in other populations now that are using adult use marijuana. Just things to keep in mind.
Yeah, and just to add to that, DHS, you're absolutely right. In addition to the dropping population of medical certified individuals, I have to also sort of suspect that there are a lot of individuals who are coming to marijuana and different marijuana products in the rec market and have never even considered being, you know, a medical patient. And so I suspect there are immunocompromised individuals in that population as well. So, but again, I just want to reemphasize, I'm not against it. Like if I had to vote today, I would say no, but I think it warrants lots of further discussion.
Okay, we'll go to Max. Would you like to make your comments, please? I think you're still muted, Max, if you're talking.
Can you guys hear me okay?
Yes, we can hear you now. Thank you.
Okay. Yeah, first of all, thank you so much, Connor, for the presentation. So, you know, first of all, I want to say that, you know, like I have some, you know, like concern actually about aspergillus testing as well. Because, you know, as you all might know, you know, microbial, particularly fungal testing is actually one of the research area of my lab. And we have published 2 papers in 2020 and one that just come out earlier this year. So in the past 2 papers, aspergillus, you know, like based on the data that we collected from California, it's just not something that, you know, like, is often to see. So that is, you know, like, what I had, you know, from the 2022 report. And, you know, in the following paper, you know, one of the things that, you know, like, I suspect, you know, like, is that when all this, you know, contaminant regulation is coming up, you know, right around the time of 2017, 2018, when all the states across the country have cannabis program coming online, you know, I think, you know, we want to have safety testing in place, but the research of what to test for, it was not there yet, right? I mean, now we start, all the state, you know, have more testing, we start collecting more data. So I think it's a good time to have a conversation of what to regulate and what not to regulate. You know, I just want to clarify one thing, you know, like with the department that so one of the point that, you know, we talk about is that no reported illness related to Aspergillus contamination in cannabis. I wonder if this statement actually, I mean, like, does ACDHS have any information about people using cannabis, you know, based on the data that the department collect, right? I mean, is there any, you know, report from the poisoning center, you know, like that people using cannabis ended up having Aspergillus infection at all? I think that's the important point I just want to, you know, like, verify before, you know, we design on this, or before I design on it. Yeah, thank you.
Sure. Yeah, it makes
We will
sense.
definitely need to look into that, Max, to see what information we may have available in different reporting areas of the department, as well as I know you do a lot of research in this area. So if you come across anything as well, that's also helpful. And you're on mute, sorry.
I'm really sorry. I really remember a couple years ago when I gave a talk in the Sanitary Council. I recall somebody from the environmental health program actually talk about the department actually have a record of people having, you know, like Aspergillus infection because of cannabis use. So I don't actually exactly recall who actually said that, but I just want to double check, you know, you know, if this is, you know, like, if the department have any data at all on this. You know, I mean, I'm open to, you know, particularly seeing in my own research, you know, like showing there's a concern of whether we are regulating the right fungus, you know, like I can get behind this, but I just want to make sure that, you know, like we actually have that actually no reported illness associated with Aspergillus in cannabis, at least according to the department report, there's no reported illness. So I just want to clarify that information.
Yeah, and Maxwell, where I pulled that data from was there's a recall tab on Department of Health Services website. It's listed in the sources, but it shows on there by year which batches were recalled, and then you click on the report of that. Each one I found is what said that there was no reported illnesses associated.
So again, I think we'll wrap up this discussion for now, and we will definitely add it as an agenda item for the future. That's probably incomplete information from the department because it's only regarding recalls related to licensed product, and there may be other information that we can get, reportable incidents. So if it's okay with everyone, that particular about looking at reports and things like that, we will table that one and make sure we add it to a future meeting when we have some information to share.
If I could make just 2 quick comments before you wrap that, Megan. One is, I think we're really talking about Aspergillus testing. Really, it's the greatest value if we're talking about inhalable products is going to be flower, since you're likely to have destroyed the Aspergillus in the extraction process. The other thing is that let's not forget survivor bias when we're looking at have anybody reported Aspergillus issues. Really, the data is going to have to come from a health institution for it to be reliable, and it's going to have to be, oh, I came in with this issue, and yes, I smoke cannabis. I don't know how you can get reliable data beyond that. Just those 2 points.
Thank you, Marie. And I did not mean to wrap up the discussion on the potential recommendation
Oh.
that Connor was making, just about specifically about data that we had,
Mhm.
because I believe Steve also had raised his hand to have a comment.
Well, my question was, I'm just trying to understand, we're requesting to get rid of Aspergillus testing?
Correct.
Okay, that's what it's, I just wanted to make sure I understood that correctly.
Yep.
You know, in my experience, I've never experienced Aspergillus on any of the samples that we've tested. However, we have a $500,000 machine sitting in our facility there looking to collecting dust. But I'm fearful that we don't have Aspergillus because we don't have the proper testing in the state that I'm located in. It's not Arizona, that this particular machine is in. I know that there are companies that do a lot of testing or they use this microwave machine here in Arizona. There's one cultivation in particular that 100% of their product just goes through this machine. So they're guaranteed that they know their product is sterile every time. But the question for me would be for the labs, how often is Connor and all of the other laboratory teams, are they coming across Aspergillus in their findings in testing? Because there's one company out there, like I said, they're a greenhouse, but that's what they do every single batch, every single harvest, they microwave their product just to ensure there's nothing in there.
Yeah, we've seen fluctuations over the years. It seems to be paired with monsoon season tends to bring a higher Aspergillus fail rate. I don't know if it has to do with the humidity or water in the air, but it's definitely tapered off. We see a lot less fails these days compared to when the program first started. And I think that has to do with the introduction of the radiation machines.
And Connor, I've got a question. This is Victor. Just curious that so you referenced Oregon as not testing for Aspergillus any longer. Is there any other states have followed that, or any other?
I believe they are the only ones. They're leading the charge.
Okay, so yeah, I was just curious as we're talking about data on, did people get infections and so forth. I was just curious if there was more data out there in other states maybe that we were missing.
Yeah, the interesting thing that I found in my research was that it's pretty universal across the board that there's, even with Aspergillus recalls, that there are no reported illnesses with those. So asterisk for Megan, but yeah, seems to be the common theme.
Okay, Ahmed, you have a question? Go ahead.
Yeah, I think it's kind of along the lines of the question you asked, if any other states have not have taken Aspergillus off their panels. I'm not sure of that. However, there are plenty of states that don't have Aspergillus on their panels at all, which could be another thing to look at in terms of if there's states that aren't testing Aspergillus, and the premise of Aspergillus testing is to ward off aspergillosis cases. Do we see a statistically significant amount of those cases in states that don't have that? And I haven't done that research, but I don't believe that to be the case. Kind of pointing that not having it does not lead to markets that with higher rates of Aspergillus contamination in people. And I'm basing that off of Smithers operates in multiple states, and not everybody is doing Aspergillus there. So there's not every lab testing for that.
Okay, I know we've got other items on our agenda to discuss, but I know Connor, you did bring up. Do we feel that we still need more information on this at this point?
And just to point out, Connor, if you do want to make that recommendation, which is absolutely your right, just to make sure you phrase it as that the advisory council is making a recommendation to blah, 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 just so that it's consistent with our statutes. Not the blah, blah, blah part. I apologize.
I can add that. Okay, yeah, I mean, unless the state wants to, I know Megan, you made that little comment about collecting more data. I don't know if we want to table this till the next one. But I don't think anything's going to change on my end in terms of doing the motion. And so I guess in that note, then and you may have to coach me through this, Megan, but my motion would be that the advisory council suggests recommending removing aspergillus from inhalable cannabis product testing.
And are you specifically saying for medical marijuana or both?
I'd say for both, but this is the medical marijuana testing advisory committee. I don't want to separate. I don't want rec to have one standard of test and medical to have another. So in my mind, it makes sense to do it to both.
We'd never make it confusing, Connor.
Right. Yeah. Heaven forbid.
Can you give me 1 second? I just want to verify that I have the wording right before we look for a second, okay?
Sure.
Inhalable marijuana product testing.
If I could just mention that I sort of support putting off the vote by one meeting. I'm just a little bit in the middle of this and not quite sure which direction to go. And I feel like if I do a little bit more research, I'm going to feel better in terms of what I can, come into the table with this.
I agree with that vote, Murray.
Yeah,
I agree
there's a financial consideration as well that we also have to look at. But I think coming from the medical side and based on the focus of what we do, that's something really important. That's an important responsibility. I want to make sure we're dealing with the latest information, and then I'll be able to support whatever the group wants.
So just as far as the procedure goes, I'm going to reach back because I believe Connor has made that recommendation now. So it's something that if we get a second, we'll vote on. That doesn't mean that it cannot be voted on again in the future. It doesn't mean that it can't be discussed further with other information in the future. Does that help?
Well, well, I don't want to go on the record as voting no against something that eventually was really a yes because a convincing argument was sufficient for me. I'm a little ignorant here. I only know what I know, and so I want to be extra cautious. So I would encourage Connor to retract his request for a vote if that was the case, because otherwise I'm going to be compelled to say no, and I really don't want to do that without having good information.
And I think, Murray, you do have the option to abstain and not vote yes or no. Correct, Megan?
Okay.
Just clarifying with council. Again, we need a second before we can have a vote. And yes, if anyone would choose to abstain, then it would not go towards the number of votes, yes votes that we would need for the quorum, which is 9.
Well, 9 for quorum, but in order for it to pass, I would think we would need 5.
It's only the members present.
Just to be clear, Megan, we still would have an opportunity to do this in December. Is that correct?
Absolutely.
Yeah. Well, December, we usually limit our meeting to the Medical Marijuana Testing Advisory Council report to the legislature, but that doesn't mean we couldn't talk about it again in 2026. And that would give everyone ample time to look into the different ways that you've talked about as far as research.
Kim's answer was much better.
If we push it to 2026, will that delay it go into effect? I mean, rules going right now for adult use. So pushing in January with that, is there any benefit to getting it done sooner? I know we do keep December limited to the report, but we don't have to, right? Like we can add in other things to the agenda.
Oh, so and I can't go too much into this because it's not on our agenda today, but as far as the rulemaking that's currently open, that is our final rulemaking where we have the super exempt rulemaking under adult use. We can only make changes that are related to the Smart and Safe Arizona Act. And it's already largely done. There's not much more that we're going to be able to do to that at this point because we still have to provide public notice of those changes and get it filed by a certain date, which is fairly early in December, I believe.
I think it's actually November 30th.
November 30th. So no, regardless of the outcome of this particular recommendation, it would not be possible to get that into that rulemaking at this time. In the future, what that looks like for any rulemakings in marijuana at the moment, we do not have any other exemptions. So we'll be following the regular rulemaking process, just like all of our other licensing programs, just like all of the other state agencies in the future, unless a bill prompts otherwise. Was that helpful? I hope.
It was, and I guess another part of my question was, we finalized the report in the December meeting. If that is a recommendation, we're making the December meeting that we presented in the January meeting to the legislature, right?
So the way the report works, we will present you with the draft of the report in December. And what we would need from the committee is a recommendation that includes allowing us to update specific data in the report that has nothing to do with recommendations. It's updating the data that we have to, the de-identified data about inspections and deficiencies in the labs and dispensaries. And then we have to send that to the state legislature and certain other people by the first Monday or second Monday in January.
Second Monday.
Yes. And that happens every year though, so.
Yeah, yes. So every year we make a report to the legislature.
So if the vote were made today, would that make it into the report?
Yes.
And the drop dead date is the 30th of November.
That's for rulemaking.
That's for filing the rules, Murray. We can't
Gotcha.
make changes to the rules on November 30th, no.
So if the vote was
Okay.
made in December regarding this, would that make it into the report?
To the report, yes.
Okay, and that would go to the legislature in 2026. So if there is a sense of urgency on this, and we do want to talk about it sooner, it would behoove us to talk about this in the December meeting.
I'm just going back to our, again, most of the recommendations that are made to the department regarding changes that the committee recommends making through rulemaking. We do supply that report to the legislature, but the legislature is voting on bills that would become law, not our rules specifically.
Correct. And
So
I'm
in
in
theory,
line there.
in theory, if this motion was passed right now, would the department take it into consideration while finalizing the rulemaking for the upcoming changes for recreational?
Again, it's November 19th right now. We have to file with the Secretary of State by November 30th, and we have to provide public comment before then. So that timeline is basically impossible at this point.
And keep in mind that's
with that,
working days that we have because of the public comment that's required. And I know this may come as a surprise to you, but Thanksgiving is within that time frame as well. And there'll be a lot of people out and unable to make comments on that call to the public. So we just want to keep that in mind as well, because our stakeholders will want to have an opportunity to respond to that rulemaking.
I think what it all comes down to, like, whether we make it or not doesn't impact the rulemaking at all. I do think that it would be beneficial if we add further discussion in the December meeting. I know we're trying to keep that limited to the report, but since we're looking for a data side of things, we should add that to the December agenda to see where we're at, to see if we're ready to vote in December, or if not, then, you know, depending on what more information that we need. I think the worry is that if we wait until 2026, we most likely won't talk about this until February. Because December
I
can be
will
limited
say-
to report in, oh, go ahead.
Yep, no, that's not a problem. Again, we do try and keep those limited mostly for your time. And it is very difficult for us sometimes to get quorum in that December meeting, which we definitely have to get quorum in that December meeting because we have to submit that report to the legislature in January. So, but absolutely, if the council feels strongly that they would like to have that agenda item added in December, there is no reason that we can't do that. We will get to work on that and see how much information. We really will be depending on all of you also to share any information that you come up with, reports maybe from other states and things like that, if we're going to have a robust discussion on that.
And if you'll, what you find, if you would like to share that with other members of the quorum, please send it to the department. And we can send that out individually to each of the members so that we stay within open meeting law.
And post it. Well, because we have to post it, make sure that the whole public has that same information that you do as we're discussing these things. And again, it's a recommendation. And so again, that's why it's not beneficial, I think, to talk about it in work today as far as the rulemaking goes, because any recommendation that the committee makes as the Department of Health, we also have to thoroughly vet that as well. Connor, would you like to move forward and see if there's a second on this motion, or would you like to table it?
It sounds like we should table it for the December meeting, put it on the agenda.
Thank you.
And I welcome any and all. The research is pretty unanimous. It's state to state. It's all pretty similar. So happy hunting.
Thank you. No, we appreciate it, and we appreciate it and look forward to looking through all of that.
Okay.
And then, go ahead, Victor, sorry.
No, go ahead.
I was just gonna say, and I think I'm next on the agenda, and in the interest of time, we don't have a whole lot to share as far as the meeting, or excuse me, the report for next year. We will be sending that report out to the council before the meeting, so please review it before the meeting. And if you have questions on the report, please submit those back to the department so we can try and get them all answered and have those answers ready for you at the meeting so we can vote on the final report.
Okay, great. Thank you,
And-
Kim.
Go ahead.
Oh, I was just going to move into our next item on the agenda. If you have nothing further, Kim.
Nope, I think that's it. Just know that we'll probably try to schedule the December meeting fairly quickly because we'll only have, we want to get quorum. We have had where we didn't make quorum before, so we have to have time to, bookend ourselves in case we need to schedule a second meeting. But please answer the survey when you get it to let us know when you're available. So we can not only look at Connor's motion, but also vote on the report.
Okay, great. Thanks, Kim. Max, I know you've got 2 items left on the agenda
Oh,
here, so I'm
I can wrap up very quickly, like it's just 2 quick report and 1 quick question.
yes, go ahead.
So, so we have a seminar yesterday, which talk about the legal versus illegal cannabis market. It was actually really interesting, and I posted the whole record already online. So for those of you who are interested, please do check it out. And another thing that I want to talk about is that we have, let me switch another. We have 1 more seminar to go at the end of at the last seminar, of our series. So this one is more focused on the production side. It's going to be on the January 20th. So for those of you who are interested, please do check it out both in person and on Zoom. And my final item, sorry, hit the wrong button here. And my final item that I want to, report is that I have some informal conversation, with the regulator at Maryland. So they are testing terpene in one of their programs, in a different cannabis strain, different cannabis product. So we are, as a pilot project, we are going to look into the data in Maryland just to see, what they have found with different strain and different terpene. So I understand that at this council, we have some conversation about, potentially at least looking into terpene as a potential analyze for our testing. So I just want to, give a shout out, with what we are doing right now. If any of you have any research question that you have in mind about terpene, testing in cannabis, please do shoot me an email. I just want to get an idea, now that we have some data from Maryland that, my team is looking into, what is, research question that is interesting to us, for our council. So I can look into that data and report back. That's all.
Okay, thank you for sharing that, Max. Appreciate that. Anyone, any quick questions for Max?
Just shoot me an email if you think of any question.
Yep. Okay, perfect.
Just shoot me an
You
email.
good? Perfect. Great.
Yeah.
Thank you, Max.
Thank you.
Okay. I know we've got right to the end of our meeting here. It went by pretty quick today as we had a lot of items. So I certainly appreciate you all participating and joining so that we could have a quorum and have this meeting. As mentioned earlier, we will be sending out the draft report for your review that will have all the information that you'll need to review before our December meeting. And again, as Kim mentioned, we'll schedule a meeting in December and we will add the that particular item to the agenda along with the discussion on the annual report. With that, I think we are at the end of our meeting unless anyone has any last questions or comments.
I just got one question about the meeting timing. Today we took 30 minutes to let everybody get in. Is that going to be the case moving forward?
And I think the way that happens is open meeting laws, I believe, require if we're in a room or whatever that we open the doors 30 minutes before, even though, we couldn't begin till 1 o'clock, which was the official start time. So Kim, Megan, I don't know if you have anything to add on that.
We apologize for any little blips today, guys. I think you all know Fabiola was amazing and we lost her to another state agency for a promotional opportunity. So we apologize for any blips in the road. We will make clear what the opening time is and what the actual meeting start time is in the future, as well as some other little clerical things. We do have someone starting in that position soon. So she's also wonderful and has been with our agency for a long time. So we do apologize for the few bumps in the road today and appreciate your patience with us.
Sorry for being late.
Yeah, and as far as the meeting start time, I mean, in order to start the meeting, we do have to have quorum. So otherwise it's just pretty much a start and stop. So
I just want to say something about Steve's haircut.
My haircut, you haven't even seen it today.
Oh, I did. You were on camera. You were on camera.
Put it on there. It's nice and short.
Looks good. Looks good.
Yeah, come on.
And with that, if there are no other questions or comments, I appreciate you all joining today and contributing to the council meeting. I hope you all have a happy Thanksgiving and enjoy it with your families. And we will talk to you all soon. Thank you.
Thank you.
Thank you.
Doctor. Thank you.
Yeah,
Happy
bye-bye.
Thanksgiving to everybody.
Bye.
Happy Thanksgiving.
Yeah. Thanks for attending, Kimberly. Nice to see you in this meeting. You, Meg. Bye-bye.
Okay.